Okay, so for part 3 of our insurance landscape here in Winona County, today I wanted to talk a little bit about the Medicaid program. So we've also heard through the federal government with the Balanced Budget Act, known as OB3 or Big Beautiful Bill, there were really significant changes that came through that are going to clearly impact Medicaid. This was a fairly significant cut that came through, and many changes in terms of requirements and process and so forth. So I'll try to break that down a little bit here without getting into too much of the detail. What I will say is that this also will roll out over the next couple of years. So some of these are immediate, January 1st, 2026, and others will come in 27, 28, and so forth. But maybe just a little background about, Medicaid in general. We have approximately 8,000 individuals in Winona County that are in the Medicaid program, and it covers a variety of different services. So unlike other types of insurance, Medicare, Medicare Advantage, commercial insurance, and so forth, the Medicaid program actually goes even beyond health care, specific types of things. There are other social services and programs and things like that that are covered by the Medicaid program. Specifically, though, for health care, one of the things that, as we're tracking on all of this, or the things that we're going to be really looking at and really wanting to help support individuals on is the redetermination process, because Medicaid is a program that on an annual basis individuals go through and re-enroll, and there's what they call redetermination. Do you meet the criteria, and can you to be continuing in the Medicaid program? This has historically, been a pretty smooth program. There's a fairly long application process and lots of documentation that also goes through this. So it's also something that can be really challenging for somebody to try to complete on their own. So we have individuals here, some of our navigators here at Winona Health. There are support in the county. There's other support around in the community that can help people navigate that application and put all of the paperwork together and to send in that application. The state ultimately determines if somebody is eligible for the Medicaid program and then starts that process. Oftentimes, we will also have individuals, I'll just say, they might come in through the emergency room and be admitted into the hospital who maybe don't even have insurance, and so we will find out if they're eligible for that, the Medicaid program or some other type of insurance, and we will start that process here, start the application process. And what has been nice historically is that this has been what they call a look-back period of 3 months. So we can start an application while somebody is in the hospital, complete that application, and if the individual is determined to be qualified for Medicaid, there'll be a look-back period of 3 months. So any services that were provided over the past 3 months will be covered under the Medicaid program. One of the changes is that will be shortened to 1 month. Now, where that becomes a little challenging is that just the process to get through the application and the time it takes to get that determination in place, when you shorten that time frame, can cause there to be a bottleneck, so we can still end up with gaps in care coverage. So that is one of our concerns. So one of the things that we're hoping to do is to be more proactive and help people identify earlier on, like when your timeline might come up, when your redetermination is due, so that that process can start in a timely basis so that there is no gap in coverage. So those are some of the things that, that we've been thinking about and, looking at. Some of the other changes that are coming down the pike that are going to be in place, like in 26, is work requirements. So one of the things that passed with the budget, the Balanced Budget Act, was that now to be eligible in the Medicaid program, individuals will have to demonstrate that they are meeting these work requirements. There's some variation in that a little bit, which is again why I think there's going to need to be some assistance in sort of working through all of these like technical pieces. That could include certain hours of work, what type of work, and so forth. This, I would tell you, is what we hear from the state. This will probably be the most challenging change that is coming out of the entire process, is being able to validate or attest to meeting that work requirement. So the Office, of DEED, D-E-E-D, at the state is, working, on what are going to be the processes, or what kind of databases will they use. And so now it starts getting really complicated, and I'm not going to get into that because it's not established yet. But that will be one of the things that will be coming up pretty quickly. More to come as that unfolds. The other change that will also be significant for some individuals will be coming in 2027, and that is where actually, instead of an annual basis, it'll be an every 6 months redetermination that has to happen. This is specifically for a subset of individuals who do have the Medicaid program. These would be people who are from ages 19 to 64, typically don't have any children, and came in under what is known as the expansion plan. So this is under the ACA, or what is known as Obamacare. When they expanded the Medicaid program, there was a group of adults that were now eligible, if you will. That particular group is the group that will have to go through the 6-month redetermination process. Again, that doesn't happen until 2027, and we'll have a lot more information, I think, as some of this all of these pieces start getting more detail and process around them, and we will be able to help folks, sort of navigate through some of those kinds of issues. When you think about the population, when I say that there's like about 8,000 individuals, I think it's also important to know about 45% of those are children. So I think that sometimes there's some misconception that, there are a lot of people on Medicaid that aren't supposed to be. I don't share that opinion. I think that the process is really pretty good, and it's pretty clear, and the application process is very detailed, so it really sorts out a lot of those things. But I think it's very important for all of us to understand that at least in Winona County, probably about 45% of the individuals on Medicaid are children. And then of course you've got parents, typically single parents of those children that are on the program. We also have individuals with disabilities, and then elders. And so a number of elderly folk are eligible for Medicaid, and in some cases Medicare at the same time, and we call those dual eligibles. They are on Medicaid and Medicare. Where we see this happening, on the elder population, where this shows up a lot, is in nursing homes. So in rural communities, it's not uncommon that about 70% of the folks that are in a nursing home are on Medicaid. And that would be true here at our facility, and I think in our community in general. So again, that's another population that has certain requirements around spending down and so forth to be eligible for Medicaid, but it's a very big population, really dependent on that program for the care and service, of what they need in sort of their later years of life. And then the final thing I would say is that, again, there are a number of programs and services that support people in the community, typically through county programs, maybe some of the other social service agencies that are covered by Medicaid dollars. And so again, this isn't simply a healthcare program. It's a much broader program than that, but it does help people continue to be able to thrive in the community. And so I think, while we look at a lot of things from a healthcare perspective here at Winona Health, we're also very aware of, sort of more of the whole person and the sort of things that they have to navigate, and how all of those services kind of come together to help people stay healthy and well and thriving, in our community. So as we're not quite as close to some of those changes. Those are what other organizations, are working on. But certainly, just by going through the process of applying for Medicaid, you would qualify for, whatever the different programs and services are. So it's important. We want to be proactive. We want to get in front of and again provide education and knowledge and awareness to individuals so that nobody kind of gets caught up short, or as the new processes with the state are being put in place, that we don't end up with big bottlenecks and gaps in coverage for folks that really need this type of coverage. So there will be a lot more that'll come out over I guess the next year, 2 years, as we kind of are into this new era of change. But for right now, we're going to just focus on getting timelines in place, having people be aware of when they're eligible, making sure those applications get in a timely basis, and the documentation to support the application, which will now include the work requirements. So we're here to help you. We're here to help navigate, and we will continue to work through all of these changes together. So thanks for listening, and just watch for more in the future.